All right. Hello, everyone. Thank you for joining us. Our webinar this month is Align, Empower, Adapt, a practical webinar on collaboration, governance, culture, and agility. I'm Cassidy Ovulin, the program coordinator with the Texas A&M Health Rural Engagement Program. And before I introduce our speaker, just a couple of comments. We are recording the webinar. We will share a copy of the slides and a recording with you in a follow-up email. If you'll give us approximately 48 hours, by the end of the week, we should have this out to you. We will have time for Q&A, but do feel free to drop your questions into the chat during the presentation, and I will absolutely make sure that our speaker gets those at the end of the presentation. I would now like to take this opportunity to introduce Mr. Jim Marshall. Mr. Marshall has served as a rural hospital executive for over 18 years and has been the president and CEO of Utah Basin Healthcare since 2014. In addition to his leadership at UBH, he serves on the Utah Hospital Association Board of Directors. And before joining UBH, Jim held executive roles as president of CHI St. Alexis Health in Devils Lake, North Dakota, and CEO of, I hope I'm going to get this right, Sakawea Medical Center in Hazen, North Dakota. Outside of his professional role, Jim enjoys spending time with his wife, Jessica, and their three sons, Preston, Nathan, and Owen. His personal interests include aviation, woodworking, fly fishing, and snowboarding. And we are so excited to have you here today, Mr. Marshall. I will turn it over to you now. It's all yours.
Perfect. Thank you very much. And a big thank you to the Texas A&M folks for the invitation to be here today. As a rural hospital executive, I've always learned so much from my peers across multiple states, and I love coming to conferences where we can network and talk about challenges and strategies and how we can collaborate, because rural healthcare is different, but it's the same. And, the challenges we face are always very similar. And I also want to give a huge shout out to Cassidy for trying to pronounce all those names. I think I was looking for new jobs. I was trying to figure out, where can I work that has some of the most challenging names to pronounce. So thank you for tackling those very well. Today, I thought I would just try to really approach the conversation by really focusing on how we can align strategy between our hospital boards and our executive teams, because we have so many challenges that we're facing. And so as we look into the future, I think it's absolutely critical that we begin to really focus in that area to try to drive strategy and implementation as quickly as we can. So as we kind of get started here, I'm just going to walk through, a couple of things I want to really focus on. Over my years and experience of working with different rural hospital boards, there's a number of things that I feel like have really helped to expedite strategy, that have really helped to drive performance. And I want to kind of walk through a few of those today. The number one is really aligning strategy and mission through collaborative governance. So as we look at our success and our ability to really drive the strategy of rural healthcare, having a board of directors that is actively engaged at a very high level of governance really helps us as CEOs to be able to drive that effectively. And so we'll dive a little bit deeper into that. Another big piece that I see is strengthening our culture through strategy clarification. So as we look at driving strategy, if we have a clear mission and strategy is clearly defined, we can really build a culture within our organizations that are focused on that type of growth and that type of movement. So we'll dive into that. And last but not least, developing agile governance and management practices. As we look at deploying strategy and we go through the process of developing strategy, that's one component. But as we look at how do we actually operationalize that in a way that it keeps our board members engaged and it keeps our executives engaged, so that we're more successful at moving our strategy forward more quickly.
Jim, I'm sorry to interrupt you. Is your microphone all the way up? I have a couple of comments that it's a little muffled and a little distant sounding.
That's a great question. We'll try.
How is this one?
That is much better.
Yeah, better? All right, perfect. Okay, very good. So just to kick this off, I thought I would share just a little bit about us as an organization. just to kind of put this a little bit in perspective of who we are, where we are, because we look very much like many of the other rural hospitals that we're probably speaking to. Our hospital is based in Duchesne County. That's another one, Cassidy, I wouldn't make you have to try to pronounce. Uh, we are right on the border of Uinta County, and our service area also includes Daggett County, which you can see there, the very far top right corner of the state of Utah. And so we're nestled right on the border of Wyoming and Colorado. And just a kind of a fun fact, Daggett County is where we have one of our very small clinics. And to get there from our hospital, you have to go over a mountain pass that's 8,400 feet to reach that clinic. So a very remote part of the state of Utah. Roosevelt itself, we're a small town. Population is, just under 7,500 people. And something that kind of makes us I think in a lot of ways fairly similar to the state of Texas. Our service area is actually oil field country. So we're all oil. So we have the oil field, we have natural gas. And so if you've ever heard of Dinosaur National Park, that is located within our service area. So gives you a little bit of an overview of who we are. Kind of compared to Texas, I thought this might be interesting to kind of share a little bit of a view of where we are and how we compare. So our service area is quite large. We actually can fit the states of Delaware, Rhode Island, and Connecticut into our Tri-County area, which we serve. And as you look at our geography, we're actually surrounded by, being the Uinta Basin, we have two mountain ranges we have to cross before you get out to Salt Lake City. So very geographically isolated, and I would really consider us to be more of a frontier type location just due to the geographic restraints. Our county population overall, we have about 60,000 people that we serve in our region, which as a rural community provider, it actually is a pretty good sized population that we serve, but it is very geographically isolated. A little bit more about who we are. We are only one of 9 independent rural hospitals in the state of Utah. I believe in Texas, I think there's somewhere around 25, somewhere in the 20s, I believe they're still independent. That number could be completely wrong. I Googled it, so it's probably not accurate. But we're one of 9. So very few that have not been acquired by the big systems. And as a rural healthcare executive, I absolutely love being independent. We have so much flexibility to really drive change and be agile because we don't have that large corporate structure that we have to report through. We are a 501c3 not-for-profit organization, and we have a local board of directors. So we have 9 board members that I report to. We have approximately 80 physicians and APPs. And we've been very aggressive at trying to bring in new specialties that kind of borderline having the market to support them. And so far, we've been very successful at being able to sustain some of those specialty practices. And most recently, we're just over 1,000 employees in total across our healthcare system. So a little bit more detail, we are a 49-bed PPS hospital. If I had my choice, we would actually convert to critical access. Our inpatient census does not exceed 25 inpatient stays on a routine basis. Unfortunately, we're a little bit too close to another hospital that's about 32 miles from us. So we've been unable to convert to this point. In addition to that, we have an emergency department on campus at a Roosevelt hospital. A few years ago, we opened the very first rural-based standalone emergency department, which has been it was a huge undertaking, but it's been a great success for our community members in providing and extending care. We also operate 6 clinic campuses across our region. And in addition to that, we have 2 urgent cares and 3 on-site retail pharmacies as part of that operation. We also have a 90-bed nursing home and rehabilitation facility. We run ambulance services across the region with 5 bases, 2 dialysis centers, cancer care and infusion. We're actually opening up our second cancer care and infusion center. We're actually moving in tomorrow with operations starting in about 2 weeks. So that's been a really exciting project. In addition, wound care and hyperbarics has been a service line we opened up about 5 years ago, and it's been amazing to have that service located in our community. And last but not least, one of my favorite projects has been building a community wellness center. We took over an old Shopco. When Shopco closed a few years ago, they had a brand new building they had built in 2017. We're able to acquire it at a very low cost and converted it to our physical therapy, occupational therapy rehab center, and then added a 22,000 square foot fitness center in our community. So it's been a very exciting organization to operate, and we've not always been really this large. Our board has given us a lot of flexibility and a lot of ability to really think outside the box and try to drive change and really focus on access to care for our local community members. So I want to kind of just dive in from here, from our organization. I want to kind of look at the state of healthcare today. With all of my peers that are on the call today, as we look across the country, healthcare is constantly getting bombarded with increasing regulations, financial challenges, and the state of healthcare, as you can see, we have a lot of hospitals across our 50 states that are in risk of closure. And so strategy and looking at how we can expedite strategy and think differently about healthcare in rural America is going to be absolutely critical to our future. The next piece that I like to always focus on that I think is not getting enough attention and really should is Medicare Advantage. I really see Medicare Advantage as the silent killer, of rural healthcare. As we're seeing MA plans grow, as you can see in the graph here, the very bottom blue line, back in 2010, just over 10% of MA plans were in rural. Now we're up to about 40%. And I think most of us know that for our critical access hospital and our rural health clinics, this directly affects our cost-based reimbursement, which is really putting our hospitals and clinics in a really challenging place to operate today financially. I wish I had more up-to-date data on this. I tried to find some data from 2022 through 2025, but I think this really paints the picture of where we have been, and I believe the story continues to get more difficult. But pre-COVID, our average operating margin was about 1% across our rural hospitals. During COVID, we saw the big spike of increased money coming in to help support us during that time, and so we saw those profit margins increase. But post-COVID, it dropped now below pre-COVID rates. And as we're seeing the workforce challenges, as we're seeing continual decline in reimbursement, and now with the bill that just passed, we're expecting to see additional cuts to our Medicaid programs, which will make it more and more difficult for our rural hospitals to stay viable financially. So I wanted to jump into looking at the role of the board today, and that's really what I wanted to really focus on and share with you some of our experiences. We went through some pretty significant challenges as an organization, and we had to pivot with our board to really engage our board at a different level to overcome those and to get where we are today. And so as I look at the role of the board in strategy deployment specifically, the roles board really is to define the mission or the purpose of the organization, and then to set strategic goals and initiatives. I see that as the most critical and most important part of what our boards need to do. The second is overseeing board governance and development. I believe there's a direct correlation when we look at high-performing boards versus lower-performing boards and their ability to support and drive strategy and success. And what I really mean by that is we get into looking at, I've seen in my career many times where if your board is not united in strategy and the direction the organization needs to go, it's very easy to get lost in minutia. And so we'll talk a little bit more about how we can try to drive that better performance with our boards. And last but not least, ensuring accountability. And when I say accountability, I'm not just talking about holding our CEOs accountable for the strategic initiatives that we have to deploy. It also is holding our board members accountable to ensuring that we're operating at the highest level of board governance possible. And so I like to jump to a little bit of a strategic reference to aviation. As we know, aviation is referenced many times in looking at safety and performance. As a pilot personally, when I fly, if I fly from my home here in Roosevelt and I fly to visit my parents in Idaho, as I take off, my GPS, I can align perfectly to my airport destination. But if I don't take into account the winds that are coming from the west or storms that are coming in, it's very easy to get off course. And so creating that strategic alignment with our board members and in making sure that our board is united in strategy and where we're going, but also ensuring that we are setting strategy and really focusing on where we need to end up is absolutely critical. And from my vantage point, that really starts with defining our missions and our visions as an organization. And so that's something I would just challenge each of our CEOs to take back to your boards if they're not on the call today and really discuss, when was your mission and vision last reviewed? When did that take place? And if it hasn't taken place in the recently, then I would just ask the second question: does your mission and vision still define your current purpose and where you need to be headed as an organization? And if either of those questions, if you look at that and say, our mission really doesn't, maybe doesn't align right where it needs to be, I would challenge you as board members and CEOs to take the time and really focus on redefining that mission and vision, because it's absolutely essential to developing your future strategy. I know as a board we'll sit down and we'll have some really deep strategic conversations, and we'll talk about moving in directions that might be very unique, or we might be taking some risk in what we're trying to do. Our board always, I've had a couple of board members that always look up on the wall and they'll say, all right, they'll read the mission statement and say, does this decision really align with our mission? And if it does, our board typically moves down that path of saying, let's support this, let's move that direction, and let's try to move this strategy forward. And so I would just suggest take the time you need, spend the time, and really reset your strategic focus for your future. Moving on to roles and responsibilities. I always like to, in aviation, I always like to think about how we operate in terms of airspace. So looking at this depiction, our board of directors, if they're operating where we really need them to, defining purpose of the organization and setting strategy, we really want them operating at the highest level of board governance. And the role of the board at that point is to work with us as CEOs to help set that strategy. And as we set the strategy and we determine that direction we're going in, it's my job and it's our jobs as CEOs to take that information from the board and really push that down through our organization by involving our executives, our managers, and our frontline staff in deploying that strategy. In my career, I've seen a lot of times where, we see this all the time, where we have our board of directors who will sometimes dive below their appropriate airspace, and they'll begin working with our frontline staff or engaging managers. And it's really critical and important that we have our boards really functioning at that high level, working directly with our CEOs and our executives to make sure that we maintain that proper level of board governance. So how do we do that? How do we work with our boards to make sure that we're on the right track, that we have a very productive board? Number one, I think, is engaging our boards in external education. I believe personally, the more educated my board is on healthcare issues today, the more effective they'll be at helping us set strategy and driving strategy forward. And so in educational events like what we're doing today, or attending the NRHA or American Hospital Association World Conferences, things like that can be really beneficial to engage your boards. And I know it's at times the cost of doing so might feel out of reach, but I really believe that it really will pay dividends long term if you're able to engage your board in that way. The next is an internal focus on board improvement. And so the question I'd always ask our board is, are we operating at the level we should be? Are we focusing not only on the operations of the hospital, but are we focused specifically on improving our board performance directly? And so do you have committees of the board that are working and focusing on elevating that level of board governance? And the last is board composition. I think it's important to always look back and say, do we currently have the right composition of board members on our hospital board? As things change, you may pivot from one strategy to another. Do you need to have a board member who has more experience in the area where your board is moving? Another area I would focus on is when you look at the composition of the board. My first hospital, Sakakawea Medical Center, I was actually at as American Hospital Association conference last year, and I ran into a board member who was on my board at the time when I was hired. And that was my very first CEO job, and that's been 17, probably about 16, 17 years ago that he came on the board. And I think it's always important to look at board member composition. You know, are we setting term limits? Are we setting, you know, that, so do we have three-year terms? Or, you know, what is the board's position on term limits and total time spent? I think it's important to have some turnover on occasion. I think it's healthy. And so really focusing on that internal process of how your board operates, I think is very important there. So why do engaged boards improve success? We've kind of covered this a little bit, but when we have an engaged board, we can really focus on these different levels of focus. So really helping us define strategy. If we have a really high functioning board, it empowers our leaders to function at their highest level of ability within the organization. It elevates board effectiveness. And as we look at resource deployment, if we have a very effective board and we're trying to figure out where do we allocate human capital, where do we allocate our scarce financial resources, if our board is functioning very well in collaboration with our executive teams, we can do a better job of deploying those resources where they're needed. And last but not least, I would say CEO retention here is critical. When we have boards that are working well and involving our CEOs and engaging at the level we need them to, I truly believe that improves our CEO retention. And as we have higher retention rates of our CEOs, you typically see higher performing organizations that correspond with CEO tenure. And so those are some things that I think are really important as we look at how do we engage our board and work with our board. So as an organization, I thought it'd be helpful to kind of give you a little bit of a case study and show you as an organization what we have gone through in our board journey and some of those successes that have come from that. So looking back to 2014, when I started the organization, we were struggling, and we had a 0.8 operating margin the year that I began at the organization. Actually, it was after I just moved here. I hadn't even started at the hospital. I just moved into a home right next door here, and I had one of the physicians that I had known during the recruitment process reached out to me and said, "We're having a discussion here in the boardroom of the board in the hospital, talking about potentially breaking away from the hospital and creating our own clinic and our own operation." And so they pulled me in, and so we were having some major challenges there. And then right at the end of 2014, 2015, we had the oil field collapse. And so there was just a lot of challenges that we were going through at that point in time, and we felt a need to start to look at ways we could pivot the organization to course correct. And one other piece I'll just add, at the bottom, you'll see the limited growth opportunity. We actually were in a position where we transitioned from being a county hospital to being a 501c3 not-for-profit. And at the time of that transition, our county didn't want to completely give up full control over the hospital. They never wanted to see the hospital become part of a large system. And so they kept the ability to appoint our board of directors. And one of our competitors at the time took note of that, and they went through the process of changing a state law just enough that it precluded us from being able to expand beyond our county borders. And if you remember the first slide I showed you, we are right on the county border between our two counties, about a mile from the hospital. And so what that really did was limit our ability to expand into that market. And at the time, about 29% of our patients came from the other county. So this was a real struggle for us as an organization. And so what we ended up doing, and this kind of shows we had some advancements in technology. We were still moving things forward and trying to really drive innovation and bring new services to our community that were critical, but we didn't have the ability to really go as far as we wanted to. So around 2018, and actually probably about 2016, our board began a lot of the boots on the ground effort to work with our local politicians to start the process of having conversations around restructuring our corporate documents and removing the barrier that we had placed on us to be able to expand beyond the county borders. And so we went through that process, and in 2018, we completely reorganized the organization. The county commissioners no longer appointed a majority of our board members. The board internally decided at that time that they would create a governance committee that would be focused on board member advancements and board member performance, and really try to drive our board to be a more high-performing board. And then in November of 2018, we actually engaged a consultant and brought somebody in as a mediator to help kind of work through or a facilitator to help us work through the process of redefining where we wanted to go as an organization. What was our purpose? And how do we define that? And so we went through that process. And really, after that, all of that work had been done, we set a very clear focus on where we wanted to go as an organization. And we began the work of a drastic expansion of services, really focusing on access to care. That was the biggest driver for us. And trying to figure out how could we bring as many services close to home for our community members as possible. So we went through a number of different expansions. We added cancer care and infusion. We acquired a primary care group from our secondary service market that we can now work with. And we began 2 major expansions of our campus, including that standalone ED in Vernal. And so a lot of work really started to take place. And a couple of really fun projects, our fitness center and then a nature park that we were able to build in collaboration with the city that backs up to our hospital, that allows our patients to leave and go take a walk on ADA trails right behind our facility. So what did this do to the organization overall? And so as you look back and you could see when we went through that big corporate restructuring, that was around that end of that 2018 period. And you can see that when we went through that process and really refocused our efforts, we went from a very low, we basically doubled our net revenues over a 10-year period and saw some incredible growth. Another piece I like to look at was our net revenue per FTE. So as we were investing in additional providers or additional staff members, we saw almost 150% return on our investment for every FTE that we added within the organization. So as we start to really look at this from a big picture perspective, as you look at this, it's a busy slide, and I did that on purpose because as I look at everything that we have coming at us as rural healthcare CEOs, I feel like we're constantly being bombarded with the challenges of strategy. Where do we go? Where do we focus our energy? And there's just so many initiatives and so many things we have to have on our radar. How do we really look at everything that we need to do and focus it to where we're hitting the most critical and the most important parts? And this is really where the board comes in as we start working through that process. And so I like to look at active management of strategy kind of from this perspective. At the top, we have our mission or purpose of what we're here to accomplish. We have our vision. What does that future state look like, where we want to reach? We have our values along the way. And then one of the critical components and what we've been able to do as an organization in aligning our strategy back to the mission and tying that back into actually operationalizing what we're doing, it comes through a lot of work around our strategic pillars. And so this is something that I wanted to kind of share and break down a little bit more into detail. From our strategic pillars, we come up with our strategic goals, which we call our strategic focus areas. And then from there, we develop our metrics around reporting and how we're actually progressing in our strategy. So I'm just going to share with you a little bit about our mission, our vision. As we sat down in 2018 and we began working on our mission statement, we brought in the facilitator and we had a lot of conversation around what are we really about as a healthcare organization and what should our purpose be in supporting our communities. And for us, it came down to 3 major components. One was caring for our communities. So really focusing on the healthcare aspect. We're a healthcare provider first and foremost, and we have to provide high quality healthcare to our community. The second was access. Being so geographically remote, a 2.5-hour car ride each way to go to Salt Lake really limited our patients' ability to receive care. And so we looked at this and said, we have got to expand access to care and really bring that care locally if we want to fulfill our vision. And last but not least, as a not-for-profit healthcare system, investing back in our community was something that we really wanted to do. We wanted to be seen as helping to push agenda items that really needed to be supported in the community that maybe weren't receiving as much support as they needed. So the next step, I'm going to drop down from here. So we just walked through our mission, our vision and values, for me, this is where the strategy really comes together. And so after we developed our mission, vision, and values, we sat down between board members, our executive team, we involved some of our physicians and staff, and we tried to break down into bite-sized pieces three major areas that we felt that we had to be focused on. Number one was patient experience. Number two, physicians, providers, and staff. And number three was performance excellence. And as you can see under each of those, we actually broke it down even further. And we broke down into categories that we felt were important aspects that we did not want to lose sight of as we drove our strategy. And so I'll dive a little bit further into this. So you'll see performance excellence and some of the categories we have underneath that. We went to the level of saying, here are the details behind each of those. So as we try to set strategy under performance excellence as one of our strategic pillars, during the years we're working through our strategic planning session, we'll try to identify those strategies that we feel are the absolute most critical. And then we like to align those back to these performance categories and really create almost a little bit of a balanced scorecard approach, making sure we're focusing on performance excellence, but also the other areas as well. And so from a board's perspective, as you have those strategic planning sessions, as CEOs, we typically will bring to the board and say, here's what we believe are the most critical areas for us to focus on. And as a board, helping to work through that process of clarifying, are we on the right track? Do we need to course correct a little bit? Are there any blind spots we may not be catching? And how do we then work with our boards and our executives to really finalize those strategies that we want to deploy? And then next piece is really, I believe, taking that balanced pillar approach. How do we make sure that we're balancing out the employee importance, patient experience, as well as financial performance? So I think that's always important to take into account. Let's keep a balanced approach to how we do this. And then the last step, this is maybe a little bit unique from how others might approach strategy. I know a lot of organizations will focus on maybe 3 to 5 key areas that they're targeting. Those are their strategic goals. We've tried to take that down maybe another step. And we really try to focus on, I would say probably on average about 15 goals. And the reason for that is there are so many critical things that we have to get done through the year. Yes, we're going to have the net revenues. Are we hitting our profit margins like we should? We may have another focus on maybe our days in AR, but and the quality initiatives. But there's also a lot of very key components of our strategy that we have to move the needle on every single year. And my experience has been, as we go throughout the year and as we have all these fires that start to burn across the organization, if we don't clearly define those major areas that we have to tackle, it's very easy for us to put a few of those on the shelf and to lose sight of those. So as an organization, we've just made the decision to say, let's focus on a bigger, broader group and let's manage to that. And so that's our approach. As we look at accountability, so as we set those 10 to 15 goals, the biggest component that I think is the most critical is involving the board in that strategic implementation. So I always look at you can have a great strategy and we can try to get to the execution side, but we have to have really good accountability in the process. And a lot of times I feel like we meet as a board, we'll go through a lot of different information. But if we don't have those strategic goals always in front of us, a lot of times we won't, maybe the board might lose sight of those goals over time, or they might lose sight of where we're trying to go. And so having some accountability built into how we manage these, I believe it creates better board unity and helping us to make sure that our board is just as focused on these strategic initiatives as we are as executives. And how do we do that? How we like to approach that is from this perspective. And this is maybe the secret sauce of what we have found that's really helped us to move that strategic needle. So we roll all of our strategy up to our board of directors, but we primarily do that through our board committees. And so when we create our strategic goals, we actually assign each of those goals to a board committee. And then every time we meet as a committee, we give the board an update on where we are in that strategic project and what the challenges are, and how the board can then help us as executives to overcome some of those challenges. So, you'll see a few of those here. We have a finance, audit, and compliance committee, quality committee. Joint conference has actually been one that has been very successful. And this is a committee that's composed of our board executive committee, our medical staff executive committee, as well as our executive staff representation. And this has helped us immensely as we're dealing with a lot of strategic initiatives that involve our providers. If we get pushback or we're having challenges, we have both of those leadership groups alongside our executive team to help drive those changes that we need to through those committees. Governance always takes on a lot, as well as our executive committee. But this is how we like to roll that down. So each of our committees may take 2 or 3 goals, and then we can spend the time that we need to in committees doing the hard work that then gets rolled up to our full board as part of our consent agenda where it's reviewed. The next piece that I think is really important that we actually put in place about 6 months ago is we were starting to talk about our next strategic planning session. A lot of times as executives, we're working on strategy. We're trying to look forward to say, where are we needing to be headed? But we may not bring all of that information to the board. And so we added an agenda item that is always on the agendas now, where we have a portion of our time carved out specifically to talk about strategy. And so as we go throughout the course of the year, our hope is by the time we get to our next strategic planning session, we already have a number of items that we feel might roll over to next year's goals. And so this has really been the process for us that has really garnered a lot of traction. And it's helped us to break those goals down into bite-sized pieces that our board, I think, finds very useful. One of the last pieces I'll just mention is incentivizing some of your strategic goals. 35% of our hospital CEOs do not have incentive plans. And I personally feel like when we incentivize strategy, we implement strategy more quickly. We're able to create that alignment. When you look at other executives, 60% of other executives have incentive plans. As an organization, when I first got here, I was the first CEO to have an incentive compensation portion of my salary. None of my other executives did. And I worked with the board to create a structure that really aligned my incentive goals and my executive team goals are identical. And so as an organization, my success and my team's success should drive our strategy forward. And it's really been very successful. And we've included my executive assistant is actually part of our incentive compensation plan. And she has been essential in helping us to drive and make sure that we're on task as far as our meeting schedules, the timeframes in which we have to complete our strategies. So that's just something I would always encourage our boards. If you don't have a plan like this, I would encourage you to at least evaluate that and see if that might be something you can tie back into your strategy implementation process. And so in summary, as we look at this from a board perspective, I really believe the more we can engage our boards in the strategic planning process and elevating our boards to function at that high level of being educated, being very proactive in the work that they do, we can drive and fulfill our missions more quickly. And I believe we can really drive strategy that is truly meaningful to our communities and can have a lasting impact on the communities we serve. So that's a lot of information, but I wanted to kind of walk through that with you and then really open it up to conversation and questions that you might have. I hope it's been something that you've been able to hopefully digest, and hopefully it's helpful to your organizations.
Thank you so much for that excellent presentation. You had a lot of great insights and knowledge. I would like to open it up to questions. You can drop those into the chat or you can unmute. Just jump in and I don't see any in the chat yet, but I'll double check. Not yet.
Jim, how have you changed your process since post-COVID? Like, do you plan for shorter increments of time with all of the upcoming changes with healthcare regulations and the financing that may be available for our rural communities and hospitals?
So how have we changed our processes since COVID as far as strategy goes? It's been really interesting. Post-COVID, we're seeing the need to be more mobile and more agile it's just getting more and more important. And so for us, we've really tried to focus in areas that really drive financial improvement and performance, clinical improvement and performance. Um, we've tried to really help educate our board at every chance we can so they understand the challenges that we're facing. I think that's the piece that I think everybody feels the challenges right now in healthcare. We feel it in our day-to-day lives, right? Inflation is crazy. We can't find, staffing at our restaurants. The shortages are there. Uh, as an organization, I think just educating our board and keeping them well involved in the process of strategy and aligning the most critical components really has been important to us. That probably doesn't quite answer your question, but we've just tried to pivot a little bit more carefully and really focus and be very open and honest with our board about those challenges that we face. So that's been probably our biggest approach.
Do you have an elected or an appointed board?
We have an appointed board. It's a little bit of a hybrid approach, actually. We have a nominating committee that appoints a majority, and then we have a couple of appointed board members, but a majority they go through a nominating committee process.
Okay. I don't see any other questions. Does anybody want to unmute and talk about where they're at with their strategic planning and maybe some of the successes and support they receive from their board or any challenges? We do have a comment in the chat while y'all are thinking about unmuting. Any thoughts on Utah and Texas applying for CMS grant for rural health announced yesterday? I just started reading that. And Dr.
Yeah.
Percy, who is our executive director, is very active in working with our state for the rural transformation program.
Yep.
Dr. Percy, you have any thoughts around the new CMS landmark
Yeah,
transformation?
it's really going to be interesting to see where this ends up. I've been asked to be on a committee to help represent rural in this capacity. And, I think we've all had to go through the stages of death and dying a little bit. At first it was, just give us the money and backfill our Medicaid losses. But we're having to come to the point where I think we have to really focus and figure out where can we get the best bang for our buck? Can we offset some of our operating costs? Or are there opportunities where we can bring in support? I personally want to see us really drive analytics in rural healthcare. We've been on that journey now for probably about 5 years, and about 2 years ago, we really finally started getting traction on the analytics side and really focusing on understanding our business operation. I think most of our rural hospitals, we just don't have the depth in analytics to understand our business like we need to. So I would love to see dollars spent to help on the revenue cycle side. How do we dive into understanding our reimbursements and denials, leveraging some of those dollars maybe to help us with looking at payer negotiations? How do we get paid more, really more fairly from our insurance companies? They know that we're small, they know we don't have the bandwidth, and they take advantage of that. So I think a lot of effort could be put in around that side, as well as telemedicine and collaboration with our larger facilities with telehealth. How do we start to leverage telemedicine to bring providers, maybe specialties, into our rural communities? I think there's a lot of opportunity there. One thing that we've done that I think I met with a couple of folks within Intermountain Healthcare last week, and really trying to push for opportunities to look at extending some of these specialists that we may not be able to support with our population in our communities, to say, let's create a collaboration where we can train some of our APPs in urban and get them trained to where they can practice independently in that specialty, come into our rural communities, but have that relationship with an oversight with a partner physician that they can work with to be able to extend a lot of those services out to our rural communities as well.
Jim, great comments. Melissa introduced myself. I'm Kia Parsi. I'm the executive director of the Archie's Institute. I think all great comments. Now, the CMS funding is through applications by the state. So would love to work with Utah and or work with you and your organization. But specifically for this, it would come down from whatever the state applies for. And our state in Texas did have a public comment period, which we provided a number of different concepts, and many of them are related to what you just talked about. I think
Awesome.
The desire here is something that can be an investment for sustainability.
Yep.
And we see the challenges historically with rural healthcare from a funding perspective and a workforce and capacity perspective. So I think the things that you talked about extending specialty care, using telehealth, and then the analytics, that could be things that this rural health transformation program could support. So
That'd be
we're
awesome.
excited to see. Yeah, I'm sure Utah, the state will apply, and we're excited to see what Texas will apply with as well.
Well, we'd love to collaborate. I mean, I think the more we can come together as rural providers with a united voice and really try to tackle these big issues and do it in a way that can show meaningful impact and return, right? I think that's the key. We actually just embarked on a project. I've been trying to find a way to crack the code on what payers are paying other hospitals. And we've just found some resources that are very difficult to decipher and we're working through the process, but we believe we may be able to figure out what other competitors are getting paid and what our other hospitals are getting paid. And is my hospital higher or lower? I think there's a huge opportunity to try to help through the payer negotiation process if we can get down to that level of clarity and really bolster the profitability or really ultimately the sustainability of our hospitals as well.
Yeah, great point. You know, there's Medicaid, there's Medicare, but then commercial insurance. Our institute did just that because of the new transparency laws. You are able to access commercial payers, what they're paying. Now, as you said, the transparency law is creating data that's not very transparent. So we actually worked with a third-party vendor, and we were able to do just that, Jim. So we
Awesome.
looked at maternal care and ER visits, comparing urban versus rural, and we were able to show a significant, up to 50, 60% difference between the urban, especially the metro areas and the rural areas, is what comparing what the commercial payer is paying for the same care.
Yeah. That's great. Yeah. Another area we'd love to collaborate with you on. That'd be amazing.
Well, thank you so much for your time today and sharing your expertise. Our audience is primarily Texas. Those are the facilities that we serve, but it's very nice to get additional perspective and to hear what other states are doing, especially states that are similar in makeup to Texas, because we kind of tend to think we're the only one. So, but we definitely know we're better together. So, I know Cassidy has posted a short poll. If you'll take a few minutes, that helps us with putting together future projects and presentations and helps just with the overall improvement of the services we provide. So I want to thank you all for your time today. Like I said, I know it's a busy conference season. School is back in session. All the things and the competing priorities you have going on. So thank you for being with us. We look forward to seeing you next month on our webinar. And I wish I could tell you what it is, but Cassidy may be able to share that with you.
Put me on the spot, Melissa.
I know, I'm sorry, because I didn't have it pulled up.
I don't have the name in front of me. But you know what? Following this presentation, we will send out the link to this recording as well as the copy or a link to the slides. And then you will also have some registration information for our upcoming webinars.
It's going to be about clinical documentation improvement.
Yes, thank you. Yes.
Yes.
You'll be able to register in the next email if you would like.
So thank you. If you're not subscribed to our newsletter, please do so. It highlights all of our upcoming opportunities. We have a rural health clinic workshop that we're hosting in Lubbock, October 15th and 16th. Do I have that date right? I'm going to give you lots of bad information. It's in partnership with InquiSeq. We would love to see you there in Lubbock. It is free for your facility to attend this 2-day workshop. It will cover survey preparedness, emergency preparedness, coding, billing, all things compliance and regulatory for the RHC space. So hope to see some of you in Lubbock. Thank you all again. Have a great afternoon.
Thanks, everyone.
Thank you all.
Thank you, Jim. It was a wonderful presentation.
Thanks.
Appreciate it.
Nice to meet you all today.
Yeah, thank
Take
you
care.
so much. Sorry, I put you on the spot, Cassidy. It was on the tip of my tongue, and then I was like, I can't remember. But
That's how it goes.
yeah.
I think we've got it all. So I'll end the poll. I thought he was an excellent presenter. Thanks everyone for joining us, and I will